Okay, go.
Okay. I'm Deb Knight. I'm here to do your exam today. On the general survey, I'd be noticing for any protective posturing, any obvious diaphoresis, any jaundice, any pallor, and any shallow respirations. And then I'm going to go ahead and make sure your knees are just relaxed and bent. We're going to have proper exposure here. If you're uncomfortable, you just let me know. And I'm going to just do the obvious inspection, looking at the skin, at the color of the skin, any cyanosis, any obvious jaundice, any bruises or redness. I'm going to look for any nodules or lesions in the abdomen, any obvious abdominal scars, any dilated veins, any striae. I'm going to look at the contour, and particularly from a horizontal plane, to notice any differences in the contour and its symmetry. And look at the movement and the surface, looking for motion, any obvious peristalsis or pulsations, including the aortic pulsations. The umbilicus for its location, contour, any obvious inflammation or bulges. And then I'm going to ask you to just lift your head up here and do like a crunch. Oh, that's good, perfect. And I would be noticing it, you can go back down. Notice any obvious hernia or any obvious asymmetry in the bulging. Cullen's sign would be periumbilical ecchymosis. Gray-Turner's sign would be flank ecchymosis throughout the flanks and sometimes also in the anterior aspect of the ball. I'm going to go ahead and listen to your bowel sounds. Got good bowel sounds today.
I just had lunch.
Yep. In 4 quadrants. And I'm going to also listen with my bell over the renal arteries for any bruits. And over the iliac arteries for any bruits. The aorta, and then I'm going to auscultate for venous hum over the epigastrum, and the umbilicus, and friction rub, my diaphragm, over the liver, and over the spleen. And then I'm going to go ahead and do percussion of your abdomen. And then we're going to do the liver span, and I'm going to go ahead and mark that and measure it.
I'm losing your top pocket.
Thank you. I'm going to start well below your umbilicus down here in the mid-clavicular line. And I'm going to find the mark when it turns to dull. And may I lift your shirt up here a little bit? I'm going to start up high. And we're going to mark and measure that. It looks like we have about 4 centimeters. And we are going to also percuss the spleen, and I'm going to be down here in your about the 10th inner space of the anterior axillary line, and I'm going to ask you to take a deep breath while I percuss, and let it out. Good. And the percussion note would change if there was some splenomegaly. I'm also going to, if there was splenomegaly and the spleen was coming up, I would go ahead and take a measurement of that, and I'll just show you how I would do it. I would start in the midline, and I would percuss until I heard a dull note, and then I would mark that. And then I would do it again until I heard dull, and I would mark. I would continue to do that and mark and mark, and then if it stayed tympani all the way across, I'd be done, and I would measure an approximate measurement of that size of that area to give myself an idea of how large the spleen was. I'm also going to wait actually right now, and I'm going to percuss your kidneys at a later date, so help me remember to do that. I'm going to also palpate, and on this one I'm going to push on your belly, and you let me know if there's any discomfort. This is the light, about a centimeter deep. Just hitting all 4 quadrants across the bladder area. Any discomfort? No. Good. Now I'm going to go a little deeper. Push with both hands. And you still, I want to watch your face and see if there's any discomfort on this. Any discomfort? No. Good. And then we're going to go ahead and I'm gonna push on your liver here. Okay. I'm gonna start low, just below the umbilicus here, and I'm gonna have one hand underneath, and just relax. And then I'm gonna go kind of down into your belly here, and I want you to take a big breath for me. Good. And let it out. Good. Then I'm gonna start moving my way upward. Big breath. And let it out, and then on this one I could feel and appreciate the liver edge. I'm also going to do the same thing. If I was looking for a Murphy's sign, I would ask you to take a big breath, and a Murphy's sign would be abrupt halt of your inspiration secondary to the discomfort. We're also going to get your spleen tip, and spleen tips are located way back here, so I'm going to actually just put my hand here, and I'm going to just relax, and I'm going to go as deep as I can here, and now take a big breath, and just try to go ahead and let it out. Palpate the spleen tip, which you are non-palpable. And then we're going to go ahead, and I'm going to just push on the upper margin of your bladder, just above your symphysis pubis, and I would be finding out if there was any tenderness there, or if I could feel it. And then we are going to also, I'm going to palpate your aorta. I'm going to go down and find it. We've got a nice aorta there. I'm moving my fingers just to try to find the strongest edges. And there they are. And then I would take and mark and measure the aorta for any obvious distension. And then estimate the size. And you were about 3. You were very, very small aorta. And then I'm going to go ahead and push on your kidneys, okay? So again, my hand is under here again. And I'm going to press down, and again, deep breath, and let it out. Good. And then on the other side, deep breath, and let it out. I didn't like that so well. I'm going to switch hands here. Do it again this way. See, yeah, much more comfortable for me. All right, and then your inguinal lymph nodes, and again, our patients, remember, our shorts are the skin. We're not going to expose our patient, and I'm just going to push on these are called your inguinal lymph nodes, and I'm just going to press here, okay? And you let me know if you have any discomfort, and I'm looking for any obvious enlargement. I'm going to do that bilaterally. Here, any soreness there? Good. And then we're going to do some special tests. And the special testing is for the peritoneal signs first. We're going to, the first thing is, and I'm going to just say that you have a appendicitis, okay? So we're going to have problems in this periumbilical and right lower quadrant. So cutaneous hyperesthesia, I'm just going to just touch you very gently and kind of almost pinch the very superficial part of your skin, and I would be looking at your face to see if you had any discomfort there. Did that hurt you at all? No. Good. And then we're also going to do the Markle or the jar test, and I'm going to give you a little hip check here. And did that cause you any discomfort? Another way to do it, if you want to do it this way, is for me to look at your face and tap you on the bottom of your foot while I dorsiflex the foot, tap down there. And it's always on the affected side, for, in this case, appendicitis, and ask if that hurt at all, okay? And a positive would be pain. We're also going to add, as I went around and and pushed on your belly, if you had tenderness, and I was watching your face, and let's say we're back to this appendicitis again. As I was down in this right lower quadrant, let's say I pushed in and that hurt you, and you told me that that hurt. Then I'm going to say on the way out, I'm going to pull my hand out and say, did it hurt on the way out? And if you were confused, I'd push in again and you'd go, ow, and I'd come out and I'd say, did it hurt on the way out also? And that would be a rebound. Referred rebound is if we're into peritoneal inflammation, we come over here and I push on the opposite side of your belly. I go down and come out really fast, and a positive is it hurts over here on the affected side. Now we're also going to do an iliopsoas maneuver. This is for appendicitis specifically, and on this one, I'm just going to have you on your affected side. I'm going to have you go ahead and lift this leg straight up, and don't let me push you down, okay? And I'm watching your face to see if that did that cause you any discomfort? And a pain would be a positive test. And then the obturator, that was the iliopsoas, because it works the iliopsoas. And then the obturator maneuver, I'm just going to bring you up to about 90 degrees here of hip flexion, and just relax, and I'm going to internally and externally rotate the hip. And just by doing this, this moves the obturator muscle, and a positive would be pain. Okay? Put you back down. And then, on ascites. Ascites is if we had some fluid in the abdominal cavity, and we have a test called shifting dullness. And shifting dullness means that if we have this ascites here, we would notice that it was tympany right up here in the middle, and it would be dull in the flanks. And so what I would do is I would just percuss, and I'm just going to start from your belly button here, and I'm going to percuss toward me. And it should be tympany, tympany, tympany. And then let's say the ascites started right here. It's going to go to flat. And I'm just going to make a mark on you. Okay, and I'll do it again, so I got a couple of marks here. Here, tympany, 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 flat, and I'd make a mark. So I got these 2 marks here. Now I'm going to ask you to roll on your left side. And all of that ascites in your belly is heading southward. And so now, this, where the 2 marks are here, if I let you sit here for a few minutes, that ascites is going to come down, and these 2 marks are going to be no longer where the dull was. Now I can start low, come up, and it's dull, 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 tympany, dull, 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 tympany. And all we're seeing is that the marks moved, okay? And that means the fluid inside is moving. Good. And then we also would note that if you were a female, I would consider doing a pelvic exam. In the case of a belly problem, I would just in my mind determine if it needed to be done. Same with in a male or female, we determine whether we needed to do a digital rectal exam. And I think that concludes my belly exam. What did I miss?
You wanted to go back to.
Oh yeah, thank you. And my last thing is I'm going to have you sit up for me. And just to keep you comfortable, and now I'm going to just do my kidney percussion. And just you let me know if this hurts, okay? And I'm going to just take the heel of my hand and tap. Does that cause you any pain? I usually try to start light. And then if it was a patient with pyelonephritis, I go, and he says no, I'd go a little harder. And a positive would be pain. Tap light. Any discomfort? And a positive would be pain. Okay, that's it. Time out. Done.